Good afternoon, everyone. There was no White House call today, but there will be one next week. Look, I know Vermonters are concerned as we see the rise in cases from the Delta variant across the nation and here in Vermont. This isn't where we wanted to be, but we need to accept that we're going to be managing this for quite some time. Fortunately, we built a very strong foundation for defense here in Vermont. As you know, Vermont continues to have the highest vaccination rate in the nation and among the highest in the world. This is helping to dampen the impacts of the Delta variant as we see its effect across the globe. What we're experiencing is a higher rise in cases and, more importantly, hospitalizations occurring among the unvaccinated. As the CDC director, Dr. Walensky, said on our call last week, this is a pandemic of the unvaccinated. Those who are vaccinated and still contract the virus are largely reporting mild or asymptomatic cases because the vaccines work, and they're still our best tool to prevent the worst impacts of the disease. Because based on the modeling we've shared and the experiences we've seen in other states and countries impacted by the Delta variant, we expect cases will continue to rise over the coming weeks. This may happen even though we're approaching 85% of the eligible population. And we've seen our vaccination rate pick up over the past several weeks. That still leaves about 85,000 eligible Vermonters who have not signed up, in addition to those under 12 who aren't eligible yet. Unfortunately, that's a large enough number for the Delta spread, as we can see from our own numbers and the rest of the highly vaccinated Northeast. Recently, we've seen several Vermont employers and institutions, especially in riskier settings, take steps towards requiring the COVID-19 vaccine. And I applaud them for taking this approach to further protect their employees and customers. I think this is a good idea. And I want to thank our colleges and universities, hospitals like the UVM Medical Center Health Network, Dartmouth Hitchcock, Mount Escusty Hospital, Brattleboro Memorial, and many others, both small and large, for stepping up. I believe all hospitals, long-term care facilities, and other places that come into frequent contact with high-risk populations should follow suit and require the vaccine. And to help set the example, I'm announcing today that my team is working to do the same, starting with certain state institutions like the Veterans Home, correctional facilities, and our psychiatric hospital. A legal team from my office and the Agency of Administration is working with the Department of Human Resources and others to move forward with a vaccine requirement for these state employees. And we'll have more details in the days to come. And to other private employers out there, as we see Delta finding its way to more unvaccinated individuals, taking a similar step could help with your business operations as well. At a time when our workforce challenges remain significant, and as a former business owner myself, I know how disruptive it can be when you find yourself short-staffed unexpectedly. If your company doesn't have a high vaccination rate, you could see major disruptions if Delta gets in. And one good way to protect that from happening is to incentivize and require the COVID-19 vaccine. In a few minutes, we'll get our data and modeling presentation from Commissioner Pichek. Secretary Smith will provide an update on vaccine clinics, and Dr. Levine will give a health update. But first, I'll turn it over to Commissioner Harrington to talk about the extra federal unemployment benefits, which are expiring next month, and what Vermonters can do to help prepare.
Thank you, Governor, and good afternoon, everyone. I do want to take just a minute today to talk about the end of these federal benefits. As many of you may know, The federal extended unemployment benefit programs created under the CARES Act are scheduled to expire on September 4th, 2021, marking the last full benefit week in Vermont for the Pandemic Unemployment Assistance Program, which is also known as the PUA program, and that is the program for self-employed, independent contractors, and others who did not qualify for traditional unemployment. Pandemic Emergency Unemployment Compensation, or PEUC, which has allowed claimants in regular UI to continue to file after they exhausted their state benefits, and Federal Pandemic Unemployment Compensation, or FPUC, which provided the additional $300 per week added to each claimant's benefit check across all of the programs. To give folks an idea of the size of these programs, as of July 31st, there were roughly 14,900 Vermonters filing for weekly benefits. Approximately 5,800 individuals were filing in the PUA program. Approximately 3,800 individuals were filing in the PEUC program, and roughly 5,300 individuals were filing in the regular state UI program. This means we are expecting that about 10,000 claimants will no longer be eligible for unemployment benefits after September 4th, and all claimants will see a drop in their benefit amount when the $300 supplemental benefit goes away. These programs played an important role in providing temporary assistance to make sure many Vermonters received the support they needed through difficult and uncertain times. As we approach the end of these benefits, it's important that those still enrolled are aware of the opportunities available to them in the job market, and that the Department of Labor can help move them into the workforce before September 4th. That's why the department has been contacted with claimants through direct mail, email, and phone, as well as through program materials to ensure they are aware of this fast approaching date and the services that are available to them. And on the workforce development side, our team of local career specialists have been conducting direct phone calls to claimants in the PEUC and PUA programs to ensure claimants are aware of the free workforce support services the department offers. We know the longer an individual is out of work, the more difficult it can be for them to re-enter the workforce. And because of this, our job center specialists and job centers throughout the state are open for in-person and virtual services, and we will be expanding the number of hours available over the next few weeks. With offices now open in-person services, offering in-person services in Barre, Bennington, Brattleboro, Burlington, Middlebury, Rutland, St. Albans, and St. Johnsbury, and virtual services by appointment across the state, our local career specialists are ready to assist you with your job placement efforts and various training opportunities. There are currently more than 8,800 jobs in Vermont JobLink, and we can pinpoint the best jobs available in each region for each claimant and help make that important first connection for the job seeker. Our team is also holding weekly virtual workshops and events, including sessions on resume writing, reemployment strategies, and interviewing, as well as virtual job fairs to help link job seekers with employers. I encourage anyone looking for a job to attend any or all of these sessions. These services are completely free and a great way to begin re-engaging with employers. You can find more information at labor.vermont.gov/jobs. We know that many businesses are also struggling to find employees and looking to fill good positions. So our team is also there to support employers through talent, through job promotion, hiring, event coordination, and applicant referrals. Employers can also find more information online at labor.vermont.gov/jobs. We know the end of these programs could be a difficult transition for some of our very close neighbors, and at the Department of Labor, we want to help get these folks back to work as soon as possible. So please, if this applies to you and you're looking for a place to start, we're here to help. Reach out to us so we know how to get in contact with you and we can help you find your next career. Individuals and employers without consistent internet access can also contact our main workforce development team by phone at 833-719-1051 833-719-1051 or by email at labor.vtjobs@vermont.gov. At this time, I'll turn it over to Commissioner Pieciak for the weekly data and modeling report. Thank you.
Thank you very much, Commissioner Harrington, and good afternoon, everyone. As the governor alluded to, cases continue to increase across the country this week, with the national 7-day average rising from 78,000 to 110,000 today. And looking at the active case map, we see that the active case growth continues to largely be clustered in the southern part of the country, where many of the states are less vaccinated. But these impacts are continuing to be felt in all other regions, including our own. But the data does point to some optimistic signs. First, the rate of new people getting vaccinated across the country is the highest it has been in over 2 months. And although cases are still rising, the rate of growth has slowed here in Vermont, regionally and nationally. And the data still clearly shows that the most vaccinated regions of our country are avoiding the worst outcomes. First, turning to the change in the national weekly case growth, we can see that cases have been rising in the U.S. over the last 7 weeks, quickly increasing from 7 to 12 to 45 to 65%. And although cases are still increasing, the percent in which they are doing so has been declining over the last 3 weeks. Similarly, looking at the cases in the Northeast, we see a similar trend where cases were rising more quickly, and then more recently, that growth rate has slowed down over the last 3 weeks. Again, cases continue to rise in the Northeast, but the rate in which they're doing so is starting to show signs of slowing down. And when we look at Vermont's numbers, we see a similar trend where cases have shot up in terms of the percent of growth, but more recently that has plateaued. We haven't seen a downward trend in Vermont's numbers yet, but it certainly has shown signs of slowing down. So with all of those indications being that potentially the case growth is slowing about 7 or 6 weeks in, fits in well with the next slide that looks at places around the world where the Delta variant has driven case growth. Obviously, first in India, then in the UK, but in a number of other countries, and then, of course, here in the United States as well. So this analysis looks at each of those peaks. It puts them all on the same timeline. So at the moment that their cases started to rise because of Delta, that is the moment here shown as the 0 date. And then we bring it forward into the future and look at what those peaks looked like in each of those countries and jurisdictions. As you can see, India, the United Kingdom, Vietnam, Myanmar, Indonesia, and also places here in the United States, including Missouri and Arkansas, where the Delta variant first landed, have all shown signs of rising for about 7, 8, 9 weeks, and then reaching a peak and then declining as well. You can also see on this analysis that the United States is just outside of that zone, about 7 weeks to just under 7 weeks away. So with the case growth slowing in the United States, it does show indication, again, that when we get into the next 2 to 3 weeks, hopefully our cases will peak here and start to go down. Again, on the next slide, we talked about how the outcomes are still significantly different depending on your vaccination rate. You can see here the states that have the lowest vaccination rate, states more in the middle of the pack, and then states at the high end of the vaccination rate, with Vermont specifically included as well. So again, even though our cases are rising in Vermont, you can see the difference in our case growth compared to those less vaccinated regions of the country. And most importantly, you can see the difference in the hospitalization rates. Again, even though our hospitalization rates are rising, they're significantly different than those other parts of the country where hospitalizations have been rising for some time and are significantly higher than ours on a per capita basis. And again, even though our hospital rates have gone up, we continue to have the lowest hospitalization rates in the country. And similarly, on the fatality side, you can see how Vermont, with 3 fatalities reported so far in the month of August, unfortunately, of course, still has a very low rate relative to these other parts of the country. Looking more specifically at the Vermont data, a chart that we showed a couple of weeks ago looks at the vaccination rates of those Vermonters who are fully vaccinated and the case rates. and then looks at the case rates of those Vermonters who are not fully vaccinated. So a few weeks ago, these lines were much closer to each other. Of course, the unvaccinated population always had more cases, but we're starting to see that split out a little bit more significantly, with the rise among the unvaccinated population rising more quickly than the fully vaccinated population. Again, another reason for those who haven't done so to protect themselves from the Delta variant. Lastly, on the Vermont data, looking at the forecast, we see, as the governor indicated, rates are expected to rise over the next 3 weeks. Again, Vermont is about 5 to 6 weeks into this growth phase. So we want to keep a close eye on those states, Missouri and Arkansas, and we want to keep a close eye on the United States rates overall. If we start to see those rates fall in the next week or two, we can have more confidence that our rates will peak and fall as well as we get closer to the end of August into early September. And then just an update quickly on the vaccination numbers. We can see that Vermont continued to increase its vaccination rate, 2,763 people this week. That's up 12% from last week. And you can see there are now about 85,000 Vermonters who are eligible who have not started vaccination. On the next slide, you can see that increase, that 12% over last week, and the fact that rates have been going up for those seeking vaccination for about the last 5 or 6 weeks. So again, a good sign there in Vermont that our vaccination rates are increasing as well. And you can see on the last slide that that means that we continue to maintain our top standing in all of these categories across the country when it comes to vaccination. So again, even though cases are expected to rise in the Northeast and here in Vermont, it continues to be the best state positioned to withstand this Delta variant rise. And with that, I'll turn it over to Secretary Smith.
Thank you, Commissioner Pieciak. Good afternoon, everyone. I'm going to cover the various walk-in vaccination clinics that will be open at schools and other sites across Vermont this week. But first, we have seen, as you have seen on the chart, an increase in number of cases, but we've also seen a demand in testing for some parts of the state, particularly in Chittenden County. And although we have a robust daily testing capability throughout the state, we have begun to leverage our EMS personnel at certain locations where we have seen heavier traffic. We are adding hours to the Pine Street Testing Center in Burlington and opening a new testing location in the Burlington District Office. This should help us meet any increased demand for testing. Just remember, testing is free and easy, so visit healthvermont.gov/myvaccine to find a testing site. So when should you get tested? If you have any COVID-19 symptoms, get tested and quarantine. If you are unvaccinated and have a known exposure to someone who is suspected or confirmed to have COVID, quarantine and then get tested at day 7. If you are fully vaccinated and have a known exposure to someone that is suspected or confirmed to have COVID-19, you are protected. If you do not have any symptoms, you do not need to quarantine. If you'd like to be reassured, consider getting a test 3 to 5 days after exposure. Turning to vaccination rates, as of today, as Commissioner Pieciak had talked about, 84.6% of eligible Vermonters have received at least one dose of the vaccine, and 75.4% of all eligible Vermonters are fully vaccinated. The vaccines are safe and highly effective at preventing the most serious effects of COVID-19, including against the Delta variant. From our nightly reports, we have seen that most of those who are getting the virus in Vermont are unvaccinated. And so the sooner that you or your eligible family members get a first dose, the closer you'll be to becoming fully vaccinated. So again, please take the short amount of time it takes to get vaccinated. Although we do see cases where people get COVID-19 that are fully vaccinated, these instances are far less prevalent if you are vaccinated. Plus, vaccination makes cases less severe and often they are mild. Given the rise in cases, especially among Vermonters unvaccinated, and given that just over 85,000 of eligible Vermonters still haven't been vaccinated, we are ramping up our efforts both at the school level and generally. We also want to support schools across Vermont to get to an 80% vaccination rate. Starting this week and over the next 3 weeks, there will be vaccine clinics in schools across the state serving all districts. Clinics will continue in schools over the next 2 months. If you are 12 or older and haven't gotten vaccinated, getting your shot now is a great way to get ready to go back to school. If you are under 18, you can register online or walk in as long as you have a parent or guardian and have the appropriate parental consent forms. It's quick and it's easy. You can walk in and get vaccinated at most local pharmacies as well, including those in grocery stores. You can also visit various pharmacy locations at the University of Vermont Medical Center, the Community Health Centers of Burlington, the Northwestern Medical Center, and the Southwestern Medical Center. In addition to these options, here's where you'll find 38 pop-up and school-based clinics just this week. Today, Manchester Elementary School, Hazen Union High School, Woodstock Farmers Market, Addison County Fair and Field Days, the Granville Fire Department, and the Johnson Elementary School. Tomorrow, Wednesday, St. Albans City Elementary School, Twin Valley Middle and High School, Oxbow Riverfront Park in Morrisville, the Addison County Fair and Field Days in New Haven, the Waterbury Ambulance in Waterbury Center, 1311 Barry Montpelier Road, that's in Berlin, it's right behind the Burger King, the Rutland Department of Health, the Health District Office in downtown Rutland. On Thursday, Burton Academy, North Country High School, Northeastern Vermont Regional Hospital, Montpelier Parks here in Montpelier, the Retreat Farm in Brattleboro, the Addison County Fair and Field Days in New Haven again, Waterbury Farmers Market in downtown Waterbury, the Berrytown EMS in East Barry. On Friday, August 13th, the Champlain Valley Union High School in Heinsberg, Morristown Elementary School in Morristown, the Halifax Community Center in Halifax, the Antique Car Show at Forest Field in Waterbury, the Addison County Fair and Field Days in New Haven, the Cambridge Rescue Station in Jeffersonville, the Newport Waterfront Plaza in Newport, and again, 1311 Barry Montpelier Road in Berlin. On Saturday, the Brattleboro Music Center and Retreat Farm. It's a presentation, Music Under the Stars. It's in Brattleboro. Mountain Marketplace in Loudonderry. Grand Isle Sheriff's Department in Grand Isle, the Stowe Community Church in Stowe, King Arthur's Baking Company in Norwich. Again, the Addison County Fair and Field Days in New Haven. Again, the Antique Car Show at Forest Field in Waterbury, Canaan High School in Canaan, the Grand Isle Elementary School in Grand Isle. On Sunday, Spalding High School in Barry. Please take advantage of the many opportunities, and as you saw, there are many opportunities to become vaccinated. And it's just not only people that are going back to school. Anybody can visit these clinics and get vaccinated. All it requires is simply a bit of your time. It's only a few minutes of your time. Again, you can find information on all of these locations at the Health Department's website, which is healthvermont.gov/myvaccine. And remember, get tested for COVID if you have any symptoms. Test sites can also be found at healthvermont.gov/myvaccine. I'll now turn it over to Dr. Levine for a health update.
Thanks very much. Let me just start out with 3 key words: vaccination, vaccination, vaccination. I say that because at this time in our experience with COVID-19, this is the number one thing, the most important action any of us can take. We have a very powerful tool, vaccines that are highly effective at preventing the most serious outcomes of the COVID-19 illness and the SARS-CoV-2 virus, including against the Delta variant. In fact, according to a study led by Yale School of Public Health, the vaccines are estimated to have saved some 279,000 lives and prevented 1.25 million hospitalizations. Even if those numbers are on the high end, that's pretty amazing to consider. Now, we know in Vermont, the tool works even better as we have some of the highest vaccination rates in the country. Now, as you heard, at 84.6%, having had at least one dose, better protecting our whole population. And Vermonters have been faithfully stepping up to get their second dose, with the rate of full vaccination now exceeding 75%, also a first in the nation ranking. We've learned a great deal about the virus, an almost unprecedented amount in more than 18 months. Unfortunately, one key aspect we know is the virus continues to evolve. And right now, the most contagious version of it, the Delta variant, is firmly established in the country and is found in nearly all of the cases that we have done whole genome sequencing on in Vermont, close to 90%. Because it's so contagious, more than twice that of the original strain, it's quickly moving through our unvaccinated population, causing cases to rise and contributing to more community spread and outbreaks. That means we're seeing rates rise in our communities again, like in camps, workplaces, and other settings. We may be just starting to see the impact on hospitalizations as well, with the majority, as expected, in the unvaccinated population. It's also leading to some cases in vaccinated people, but again, those people are still protected from severe illness. At the same time, however, our experience informs our knowledge, and with that, our ability to respond and counter the threat also continues to evolve. That's why we want everyone who's eligible for vaccination to get vaccinated as soon as possible, because that protection is how we ensure people are protected. So many Vermonters have been vaccinated, and again, thank you for taking that important step. But there are a little over 80,000 people in the state who have not yet been vaccinated, some because they're not eligible, but many who are. So to those fellow Vermonters, please know that when we urge you to get your shot, it's because as a physician, as a human being, I don't want you to get sick. I don't want you to end up in the hospital, and I certainly don't want you to die. Getting your shot is also very important if we're going to be able to slow the spread and protect those who are not yet able to be vaccinated. Indeed, I know many of you have heard this message because, as Commissioner Piczek showed, we've seen an uptick, not only nationally, but in Vermont, in vaccination demand. And if you look at news of the so-called breakthrough cases as a reason to not get vaccinated, take my reassurance that this is completely unjustified. About 2% of our cases since January of this year have been among fully vaccinated Vermonters. That's a rate of such infections in the over 465,000 Vermonters. That means less than 0.1% of those who have been vaccinated. So does taking a chance on almost definite risk of getting COVID with a highly transmissible variant, or getting a severe illness or a possible long COVID syndrome still make sense, or does getting vaccinated make more sense? It's not politics, it's not an agenda, it's public health, medical science, plain and simple. In the meantime, each of us have our own situations and day-to-day activities, days into which we once more must incorporate what works best for protecting ourselves, our families, and our communities from the virus. These are the prevention steps you've heard so many times over the past year plus. Wash your hands, stay home when sick, and call your doctor if you have symptoms of the virus. This includes masking. I get lots of questions about masking. If you are not vaccinated, we encourage you to wear a mask in public indoor spaces. This will protect you and those around you. And if you're vaccinated and you choose to wear a mask as an extra layer of protection indoors, especially if it's crowded or if you travel, that's okay too. Do what makes sense for you and your personal comfort level, and do so knowing you should not be judged for that. The science hasn't changed. Wearing a mask helps protect you and the people around you from getting or spreading COVID and this current variant. A mask contains your respiratory droplets and can keep them from reaching others. COVID-19 can spread from anyone, even if a person does not have symptoms. And the fact is, many of us have people in our lives we need to protect, including younger children who can't be vaccinated yet, hopefully by late fall or early winter, or those who are older who have weaker immune systems. And unfortunately, some of them are getting COVID and becoming ill. A mask is a temporary, simple, but effective tool we can add to the vaccine to keep everyone safer. But remember, the most powerful tool right now is the vaccine. Finally, a reminder about testing. If you have any symptoms or think you've been exposed to COVID or were in a higher risk situation, get tested. As you've heard, in some parts of the state, demand is higher right now, so it's best to make an appointment if you can. Visit healthvermont.gov/testing. Governor?
Thank you, Dr. Levine. We'll now open it up to questions.
Starting with those in the room.
Could you enlighten us about the increase in hospitalizations and those in intensive care? Are any of those folks unvaccinated, and are any children in intensive care?
I believe there are some who are vaccinated. I don't believe there were any children who are hospitalized at this time, but I would ask Dr. Levine to elaborate.
100% of the hospitalized patients are adults.
And unvaccinated?
Yeah, so 75% of the hospitalized patients are unvaccinated. If you do the math, that's 25% of the eligible population to get vaccinated are unvaccinated.
So what is your guidance to employers who see the CDC spread now, as of yesterday we had 6 counties, substantial or high, and they're saying, we have an 84.6% with at least a first shot. Should we go back to masking or asking everybody to mask inside? What do you say?
Yeah, I think, as we've said all along, for an employer, that's their personal choice. They are completely free to expect masking in those populations. When it comes to mandating vaccine, you've heard from the governor this morning, and I'll let him comment further on that. But many are joining a growing sentiment that mandating vaccine in their setting is a useful public health tool, and it's a useful business tool to keep their population of employees healthy and to keep their work environment safe.
Governor, what specific factors triggered your decision to rethink the wisdom of a vaccine mandate for some state employees?
I think it's the transmissible disease, the variant, has shown how quickly that it can spread. We have an obligation to protect the most vulnerable under our care, and I think those in the Veterans Home, the psychiatric hospital, as well as the offenders in the correctional facilities, they're under our care. So I wanted to make sure that there weren't any holes in our staffing. Now, the mandatory vaccination that we're considering will have some sort of an exit ramp as well. It won't be forced. It will be there may be testing involved. There may be some other avenue so that for those who are not willing to be vaccinated. But we just think it's a good idea considering what's happening, what we're seeing across the country. And I just want to, again, reiterate, we've seen how effective the vaccines are. We look at the number of cases who are hospitalized at this point in time, which isn't where we'd like to be, but we never said that these were 100% effective. We said the vaccines were 85% effective, Pfizer and Moderna, I believe. So there is some risk involved. But when you look at there's 99.999% of those who have been vaccinated who aren't in the hospital at this time. So those are pretty good odds. So we think it's a good idea for people to get vaccinated.
Do you know how many people would be required to be vaccinated under your plan?
I do not know. I don't know what the percentage is. It ranges, it's different for different facilities. Some within corrections, for instance. There's a higher number of unvaccinated up in the northern part of the state than in other regions.
And is this something you think about expanding to other state employees?
We're going to take one step at a time. Again, we want to, and we believe that this, as Commissioner Pichak had talked about, our modeling has shown, and we've seen this throughout the world, that this will subside and start reducing after 7 or 8 weeks. So it's not something that we're ready to impose at this point in time. But as we said from the beginning, we're watching the data, we're listening to the science, we're trying to do what's best for Vermonters. And at this point in time, we feel that protecting the most vulnerable, those under our care, under our jurisdiction, we have an obligation to try and protect.
You today are calling on other Vermont businesses to consider a vaccine/testing mandate as well. Why not take whatever steps you would need to take in order to use your executive authority to compel businesses?
We'd have to reissue the state of emergency, and I'm not willing to do that at this time. There's no need for the state of emergency.
Governor, the Chamber of Commerce, they have a survey out right now to their member businesses, I think, who will, taking the temperature on mandating the vaccine, and they're already hearing from some businesses that are saying the opposite of what you're saying, that requiring the vaccine will just be one more hurdle for them to overcome, especially recruiting workers. How do you respond?
Well, again, that's their choice, and we've recognized that from the very beginning. Whether it's customers coming through their door or whether it's their employees, they have to do their own risk assessment and decide if that fits their business or not. For many, I think we've seen that many businesses throughout Vermont have imposed this requirement. And so everyone makes the decision for themselves.
And I guess follow-up, this might be for Dr. Levine, I think this has come up before, but is there any progress made on when the state reports cases and hospitalizations and deaths, if we can differentiate between vaccinated versus unvaccinated, right? Reporting how many breakthrough cases. Some viewers have told me that could actually help increase confidence in the vaccine.
Yeah, so in our weekly updates, which are now every other week, but they're still called weekly updates, we have added several slides that talk about the breakthrough infections. So the data from that is readily available to those who regularly check that. Hospitalization data, we're working on trying to perfect that science and getting a good sense, not just for cases, but for actual hospitalized patients, what their status is, vaccinated versus unvaccinated. It's a little more challenging than just for the cases.
What are the challenges to gathering and tracking that more closely?
Challenges are that we're dealing with a heterogeneous group of hospitals that have different reporting schedules, that some of the data, would be protected data regarding patients. Some of the data might not be immediately present because somebody's admitted in distress and goes to an ICU, and they may not have access to data regarding their vaccination status, and we'd have to go to other data sets to try to find that and then combine it in. So,
If it is simpler tracking that with cases as you're putting out every 2 weeks, is there a reason the health department couldn't put out that breakdown among new cases on a more frequent basis than every 2 weeks? Because I share Calvin's feedback that we're getting
Sure.
constant requests for that information.
yeah, there's no reason why we can't do that. Again, I think the focus on it is misplaced. That's my opening comments. Hopefully convinced people. But I understand people are hungry for information of all sorts. I wanted to also just make a follow-up comment to the governors on the vaccines mandating. We're talking about populations that are very vulnerable, so as opposed to the business sector, we're talking about people who are serving vulnerable populations, which is an important consideration. And we have very variable rates around the state. Some very commendable rates in some of our healthcare systems and in our long-term care facilities, with staff equaling or exceeding the vaccination rate of the general population in Vermont, and then some notable exceptions in the other direction where they could do better. So it's a very heterogeneous group, but it's a little different to talk about those caring for the vulnerable than just in general the concept.
But you've stopped short of recommending such mandates for K through 12 schools or even licensed child care centers, which are children who can't be vaccinated considered vulnerable in this context?
Our school guidance came out last week, and it was pretty clear about, obviously it wasn't clear about mandating vaccine. That wasn't the topic. But we've already got a success rate in the education sector that's quite high, and paid special attention to that sector early on in our vaccine efforts. But the guidance was very specific about ways to help protect children as school reopens.
But you're saying when we have staff members who are dealing with vulnerable populations, we should have a vaccine mandate in place for those people. Why wouldn't that same rationale apply to staff that are working with people who are unable to get vaccinated?
Yeah, the head of the NEA, I guess I believe it is, nationally, actually has endorsed what you just said. In Vermont, we haven't gone that far.
I guess the question is why wouldn't you go that far?
Well, I'll let the governor
Well, again,
help
I
us
think we're
with that.
talking about different situations, Peter. I mean, you're talking about 24/7 in a psychiatric hospital or in the offender population or the Vermont Veterans Home, 24/7 in the same building. When we're talking about kids in school, it's not for those periods of time. So we've instituted mandatory masking in schools for the first 2 to 3 weeks, as well as for those who are ineligible to be vaccinated over time. So we think that's the right approach. Getting kids back in school is going to be better for their mental health, and we believe it's a safe approach that we're taking.
Your thoughts on your colleague in New York's decision to resign?
I just actually saw that with the mounting credible allegations against him. I think it was the right decision to make, probably not surprising, but I think it's for the best for the people of New York.
Secretary Smith, what sort of knock-on effects are you anticipating as a result of the expiration of some of these federal unemployment programs, and what are you doing? Well, I mean, I think the commissioner has been clear that this could, result in people needing food, housing, childcare subsidies, what have you. And you've got this slug of almost 10,000 people that are going to be going from not just unemployment, but the $300 weekly add-on to nothing. And I'm just wondering if that's something that's on your radar, or anything you're doing to prepare for that.
We aren't doing anything special. We've had, through our Three Squares meal program, we've had really enormous capacity in that program, thanks to the federal government and thanks to what we've done here at the state level. So I think from a food aspect of it, I don't think, we're not going to be overwhelmed from that perspective. From a healthcare perspective, we're not going to be overwhelmed as well. And I'm trying to think through the various programs that we have. We're in pretty good shape to withstand something that may come our way, whether it's virus related or natural disaster or an instance like this. We're in pretty good shape.
Just keep in mind, though, we're talking about the $300 stipend, right?
But for the people who are on PUA, the whole kit and caboodle is going away. And and more than half the people who are on unemployment right now, they're on the extended benefits, so they're losing not just the $300, but also.
Yeah, but keep in mind as well, we're struggling in every single sector across the state for employees. So I believe there are opportunities out there. We want to be able to help them find their career path and a job in the meantime, or whatever, maybe the combination. So we feel as though, and this isn't our action, this is the federal government's action, but we believe that there are jobs available for those who want to work.
Governor, maybe for Dr. Levine too, we talk about getting back to cases just for a second, but, in the next couple of weeks, those are slated to come down. But we're hearing more and more about the Lambda variant, Delta Plus variant over in Korea. I just wonder if you could shed some light as to how solid some of these projections are in light of additional variants.
I think
that are in other countries.
Dr. Levine can answer this probably better than I can, but we see this like with the flu, different variants of the flu year after year, and we're going to see this with COVID as well in the coming years. That's why it's so important to get everybody vaccinated just as quick as possible to create this line of defense so that it doesn't mutate further, right? We don't want the new variants to grow. We want to shut it off just as quick as we possibly can. I believe had we as a country had been more fully vaccinated, we wouldn't have this situation that we're in today. And I think that when you see states where they have 30 to 40% vaccination rates, this is the result of that. The variants are allowed to grow and mutate and change and get through into different populations. So this is a result of that lack of effort in terms of vaccination.
Obviously, everybody's watching Lambda and Delta Plus and whatever comes next. None of them are really present in the whole genome sequencing in this country to any degree. I think Lambda was under 1%. So they do bear watching. We don't really know what they're going to turn into. The CDC has this whole kind of gradation of levels of concern. You start as a variant of interest, you become a variant of concern, then you become worse than that if you're like a Delta. Just to piggyback on the comments that were made about mandating vaccine in different populations, I think it's clear to people, but just to be extra clear, if we mandate vaccine for who knows who tomorrow, that's not going to matter for Delta because the Delta cycle is still several weeks in duration. One dose of a vaccine won't be enough. It's really looking forward to the fall and winter and making sure that if any of the things, Calvin, you're concerned about in these other Greek letters become of concern, the population will already be prepared to meet them. So I think that's really the thrust of where we're going.
Dr. Levine, sort of a follow-up to that question. I mean, historically speaking, pandemics end. They just disappear. Well, what do you see happening here?
Gee, if I had the answer to that, I'd be on the news shows nationally every night. The pandemic, the kind of what we've been through pandemic, I do see coming to an end. But to piggyback on the governor's answer, it's not like coronavirus is going to disappear. Coronavirus is going to be here. Yes, there may be new variants, but maybe there won't be. The bottom line is we can't really predict that with certainty. We're all living through our own first pandemic. The one back in 1918 seemed to come to an end, but it didn't come to a grinding halt. If you read more about it, it sort of had its tail end lingering. So we're kind of in that phase right now, and we have to be prepared for that. And the best optimism I can give is if the efforts of the current federal administration and other developed nations around the world to get vaccine to developing nations can be successful, we will see more of this ending of the pandemic. Because clearly the variants we've had thus far, especially the Delta, didn't evolve under stress from vaccine on people. They came at times when people weren't vaccinated and were able to continue to freely transmit virus one to another. So we need to really try to put an end to that. And the most successful strategy is going to be improving our rate in this country, but continuing in parallel to improve the rate around the rest of the world of percent vaccinated.
Dr. Levine, a couple quick questions about at-home COVID tests from a colleague. She had noticed that there was a sign outside a local CVS saying they were all out of those at-home tests. She was wondering if post-vaccines, or I guess not post-vaccines, but at this stage of vaccinations, if more people are using those, how does the state find out about a case in that scenario if they're using an at-home test that they bought at a pharmacy?
Yeah, so if the person does not report it to us and the person does not report for medical care, that would go under the radar because we'd have no idea that they'd even done the test. There's some caveats in that test. So when you do a home test, if you're positive at a time like now and you did the test because you have symptoms, that's a very reliable home test to do. But if you really were worried about COVID and you had a negative test, there's instructions there about maybe you should actually go get medical care, get the sort of gold standard test, like a PCR test as opposed to an antigen test, and make sure you weren't a false negative on that evaluation. And then, of course, we would have insight into that.
Further questions were about the accuracy rate and whether they should get a PCR test, so I think you answered those too.
Yeah, although the accuracy rate, again, much better for having a positive result and believing it than having a negative result and being falsely reassured. But keep in mind, the ones that they're selling at CVS have received emergency use authorizations, so that's important.
Governor, could I ask you a question about something else?
Sure.
Over the weekend, the National Guard released its report that followed allegations of sexual harassment and some misconduct, as you know. You're a big Guard supporter. I'm just wondering, in what areas do you want the Vermont National Guard to improve?
Yeah, I haven't read the report. We do have it, but I haven't read it yet myself. But I have a great deal of faith in General Knight. He's made this his mission. I think he's made great strides in this regard. The transparency that he's shown has been encouraging, I think, for all of us. And if there's anyone who can get to the bottom of this and trying to, culture doesn't change overnight. But he is doing his best to change that culture. And again, I think he's made great strides in that regard.
How will you know you've done the job?
Well, he'll continue to be transparent and honest and open, as he did with this press conference he had the other day. And this report will continue to be somewhat of a living document, and we'll continue to look at the data and making sure that we're doing all we can.
Does it surprise you to hear that the quote, good old boy network is alive and well?
Again, culture is very difficult to change in every regard. So I can't say that I'm surprised. It's unfortunate. I'm disappointed, but I'm not surprised.
I have a couple more questions for Dr. Levine. I want to know, the Health Department on Friday night notified the public about this outbreak at a Waterbury summer camp. I wanted to know if we could get a little more information on where the investigation of that stands, as well as one basic question about it. Was this camp primarily outdoor or indoor? Can you say anything about the environment that these campers were typically in from day to day?
Yeah, so my sense is, I can't give you this with 100% certainty, that more of it was outdoors than indoors, but that doesn't preclude campers from gathering together indoors. The current case number I don't have as of today. And the reason we put out the public announcement was, again, because campers probably in a less or totally asymptomatic state were circulating within the community and not aware of their infectious status. So we wanted to make sure that people were aware of that.
Do we know anything about how the infection spread among that population? Do we know if it came from an adult, whether that adult was vaccinated or not? And does there seem to be evidence of one child spreading it to another child? Or do we
Yeah,
know?
so these are all great questions from an epidemiology standpoint, and they never are answerable in the first couple days. They take time for investigation. They take time for accumulating more people who have gotten tested and seeing what their status is. I can tell you that it's pretty I hate to say uncommon, but I think it's true. It's uncommon to often find the index case. So though it's always of interest, it's very challenging to do that quite often. I will say that, we are seeing cases in Vermont in all the kinds of settings you'd expect, from workplaces to camps to healthcare and child care facilities, all the same spectrum as we would have seen at any other point in the pandemic. That continues, but we do note that people who have traveled and returned and people who have a household contact continue to remain more vulnerable, if you will, and susceptible to getting infected. But that's not exactly different than at any other time.
How many outbreaks are currently under investigation right now?
I don't have the number for today. I can get that to you.
Is there a reason that's not reported more regularly I know that's in the weekly summary that you were talking about that comes out every 2 weeks. Is there a reason that the public can't get that information on a more regular basis?
Nothing's being hidden, and there's no reason. Frankly, it isn't super helpful, to be honest. Most of the outbreaks that we see now are of modest size. Vaccine has prevented them from turning into what they would have turned into in a pre-vaccine era. We see far more what we call situations, which are just a cluster of a couple of cases or a specific site that has a case known that concerns us because of the nature of the site. And again, these don't turn into outbreaks with great regularity.
All right, I've got to move to the phones, starting with Lisa, Waterbury Roundabout. Lisa, the Waterbury Roundabout. All right, we'll try Tom Davis, Compass, Vermont. Tom Davis, Compass, Vermont.
Thanks, Jason. A couple of quick questions for you. Dr. Levine, one really quickly. The last time that you spoke to us, you said that nearly 86% of new COVID cases were the Delta variant, if I have my notes correct. Has that changed?
It's changed to about 90%.
Okay, thank you. Governor, I've been speaking with some spokespeople at the Canadian government, and they showed their frustration that the United States government continues to say that they're working closely with the Canadian government about reopening for Canada to come into the United States. when the truth is she said, we can't tell you anything, we're ready to go. And she said, I've not heard anything on our end from the United States, but, you know, if they give the green light, we're basically, we're in place to allow Canadians to visit. I know you didn't have your call this week, but I wondered if you had any intel or even speculation as to what the heck the U.S. is doing.
Yeah, I share their frustration as well as lack of understanding as to what the holdup is. Again, Quebec, Canada overall is in better shape than we are in many regards. They should fear what's happening in the U.S. We shouldn't fear what's going on in Canada, and especially Quebec. So we have not, as you know, we, the National Governors Association, along with a number of governors, penned a letter to the White House and asked them for a meeting. We have not heard anything, to my knowledge, at this point. So we anxiously await that, but I have no idea why there's a lack of action in that regard. It just seems as though we could have a reciprocal type of reciprocity in terms of whatever they're requiring to come across the border into Canada. We could do the same for those in Canada to come to the U.S.
The two Canadian publications were speculating, also Peace and Yahoo News is on the financial side of speculating that one of the issues may be that the entire apparatus for the borders was stripped down on the Canadian side significantly during the Trump administration, and the U.S. just may not have the resources in place to handle incoming Canadians. Have you heard anything about that?
I have not heard, no, I haven't heard that at all. But I haven't heard anything,
Okay,
to be perfectly honest.
Right. Last real quick question. I spoke with the Vermont Air National Guard this morning, and they gave me some information, but I was curious if anyone in your administration has any information about low-flying C-130 cargo planes over mainly central Vermont from the reports our readers have sent. When I say low-flying, I mean just above the treetops, usually in groups of 2 or 3. That's been going on for over a month. Does anybody in the administration know anything about that?
Yeah, this is the first I've heard of it, Tom. And I live right here in central Vermont, and I have not seen or heard them, but I'll see what I can find out.
Okay, thank you. He speculated that it was one of the New York squadrons who do have C-130s. I actually saw one and got a picture of it, so I'll be checking in with that. But if your people hear anything, I always appreciate it. Thank you.
Can't blame them for wanting to come to Vermont, but I have no other info on that.
Okay, thanks. That's it for me. Appreciate it.
Ham Davis of Vermont Journal.
Just a question. I have a question for Dr. Levine. Can you hear me?
We can. Go ahead, Ham.
I'd like to ask Dr. Levine, as much as he is able, to tell us what he can know or speculate about the situation that we might get if the CDC decides that people need a booster shot. The first shots that were given in Vermont were in January and February. And there's been some mention in the media that once you get past 6 months, that the protective effect might begin to fade a little bit. What I'd like to know is, I understand that decision is not for me, but I'd very value Dr. Levine's horseback guess, his professional guess about how close we are to that question, and secondly, whether any thought has been given to how the state might deal with that. If you get a decision that the vaccinated population needs a booster.
Sure. There's a couple of questions wrapped together there. Let's start with the fact that there's really good data that shows that at 6 months, we can continue to rely on the vaccines that we've been given, especially the messenger RNA vaccine, because they were authorized, as you remember, earlier, so we have a little more experience with them over time. The J&J came online later than the first two. So there's great data there. There's data that's emerging regarding those who are immunocompromised. Some of that shows that there may be segments of that population, since that's a broad umbrella, that could actually benefit from a booster shot. Whereas other data shows that, unfortunately, though we might think it would do them good, there are many segments of that population that don't seem to benefit from a booster shot. There's also data that's in people and data that's in test tubes. All of that's being sort of analyzed and synthesized by people in the FDA and elsewhere. But the bottom line is, I think the FDA is on a fast timeline to get the full approval of the first two vaccines before Labor Day. They've been under a lot of pressure. They have a lot of data to analyze. They're putting more bodies on the effort to analyze that data. But we may find by Labor Day or sometime that month, we'll have full approval, which will make a big difference when it comes to their next decisions regarding booster shots. Nobody sees the need for that tomorrow or in the next few weeks, but hopefully we'll have more information from them regarding the timing. I think that we could certainly go to the end of the year, which would make it a one-year point for people who got the very earliest vaccine, just again based on the data that's available to review now. But there's so much more data that's coming up. We in the Agency of Human Services and at the Department of Health have really been looking at the two populations, those who are eligible for a booster at some point when that time comes, and those who couldn't yet be vaccinated, mainly the under 12. So we have sort of parallel planning processes in place for both of them so that we won't be overwhelmed. Clearly, for the adult population who might need a booster, we all know that that would be a huge effort, and it wouldn't be something that everyone could easily accomplish in the confines of their own doctor's office, so that all of the systems we probably employed earlier on would come back into play for that effort. But if, again, it might be a very restricted effort. It might be a part of the population that has immune system issues, and that would be a different challenge than the whole adult population. So hopefully I answered you well enough without saying too much.
Thank you very much. It does answer my question. Thank you.
Greg Lambro, the county courier.
Good afternoon, Governor. I'm curious, the people that are reaching out to get tested, when they show up to a testing site, are they also given the opportunity at those testing sites to get vaccinated?
I don't think all of our sites have been commingled, but that's our plan in the future. But I'll let Secretary Smith answer.
Yeah, Greg, we were moving and we are still moving towards having combined sites, testing and vaccine, about 14 of them, maybe even as high as 16 of them, situated around the state. We have not dismantled the testing apparatus that we have right now. As you know, we have approximately 15 to 17 sort of testing sites that go on. We haven't dismantled that because we've seen the upsurge in testing that people want. So we've kept that apparatus in place, but in the future you will see both of them combined, testing and vaccine, probably in your healthcare setting, such as a hospital or a urgent care facility associated with a hospital.
Okay. And secondly, Governor, as you know, some of our counties are reaching a threshold where the CDC has enacted a 60-day eviction moratorium. I'm wondering if there's any concern from your office that there may be at least a small group of people that like to see that, and it may actually have a negative impact on public health.
Meaning if they are evicted, is that what you're saying, Greg?
Correct. Correct.
Of course, we're concerned. We do have, systems in place to help those who have been evicted and support for them as well. You know, the court system now will hear these cases, and we have to have faith in the judicial process that they'll make the right decisions. But that won't be overnight either. I mean, the courts are backed up as well.
Certainly. Okay. Thank you, Governor. I'm sure we'll talk again next week.
All right, thank you.
We're going to try Lisa from the Waterbury Roundabout again.
Hi there. Thanks a lot, Jason. Does that work now?
Yep.
Okay, great. One for Dr. Levine, although based on your answer earlier, I'm not sure you're going to have much of this detail. I just thought I would check. So the latest number in the Waterbury outbreak that I received late yesterday was 24 cases. I'm wondering if that, at least if you have a sense of whether all of these cases are among children or if there's others, adults that are part of that group at this point.
You're right, I can't elaborate further on that, but I can get that information.
Okay, thank you. One other question about sort of the process that the health department engages in is whether or not there's some sort of a protocol for outreach with the community. One of the things that I'm hearing here is that the folks at the town level here with the rec program and paying attention to communicating with families feel really out of the loop, and they were really surprised to hear yesterday that the case number had gone to 24 from 13 on Friday. They're getting a lot of questions, and they don't seem to have like a point of contact as far as, you know, information flowing from the health department to update them. I realize things are moving really quickly and people are swamped, but is that something that tries to get worked into the process?
Yeah, obviously the priority is communicating with those who have been identified as cases or as contacts, and with the camp administration, you know, which is all done very early on, and that continues. In terms of updates, you know, in terms of how the situation is being managed or not managed, obviously we continue to communicate with those in charge of running the operation. It is challenging if you're looking for, you know, a daily kind of case count and a daily advisory for people, because the advice wouldn't change based on one day's cases versus the next from what we would initially have given people on day one. But I do respect the fact that people are hungry for information when they know that they may have had a family member who could have been exposed, et cetera. But hopefully they've received the proper advice from the get-go so that they know how their behavior should evolve.
Right, good point. And for what it's worth, I am hearing that the testing has definitely jumped in town in the last few days. People are definitely taking advantage of the extra hours for testing, and so that message has gotten out for people to be checking.
Yes.
One other question, maybe this is for the governor, and that's the CDC recommends at this point just a recommendation that in areas of high or substantial spread, people be wearing masks indoors. And it looks on their tracker at this point that a handful of counties in Vermont tick that box right now, including Washington County, Chittenden County. Are you looking at that at this point in terms of, you know, maybe being a little stronger in the recommendations being made to people who are not just unvaccinated, but regardless of your vaccination status?
I still think it's a personal choice. I think you have to make decisions depending on your risk, who is in your family, who's in your household, so to speak, and whether you should be going to events inside that where you might pick up the variant. So again, I think you have to do your own risk assessment and then make your own decision at that point.
Okay, thanks very much, Governor and Dr. Levine. Appreciate it.
Thank you.
Leora Engel Smith, Vermont Digger.
Hi, this question is for Dr. Levine. I want to know the cases that we do have in nursing homes right now, like what's the distribution of like residents versus staff, folks who are unvaccinated versus vaccinated, anything like that?
Yeah, I don't have a table of data to provide you with at this time. So I can tell you, though, and this is probably the most important take-home message, that situations in nursing homes in August of 2021 is nothing like it was at any point prior in the pandemic. We're not having abundant cases identified at the same time. We're not having abundant transmission across different physical parts of facilities. And when people are identified as positive, fortunately, and not exclusively, but fortunately, the majority of them are already previously vaccinated if they're residents of the nursing home and do not have severe cases. So it's a very, very different environment. Not to say that it's easy street for everyone, because obviously when a case is identified, it has implications for visitation, it has implications for the anxiety level that others have, but it's a much better situation in the vaccination era than it was previously.
Thank you. And a second question about testing. So the volume of testing is not going up because folks are asking or needing more tests. How are the sort of supplies and like turnaround time for results?
Yeah, so in terms of supplies, that continues to be a metric that we follow every week, several times a week. Every time we have a report out from our Health Operations Center, we get a report out from our facilities about how much reagent they have, how many collection kits they have. So we feel comfortable with that. We have a lot of partners in this effort, many of them healthcare providers across the state. We have no indication that they've run into problems with their supply chain at this time either. We are seeing an uptick in numbers of tests done on a daily basis, but it's still much less than it was at a time when we were doing a lot of surveillance testing in schools and nursing homes, in hospitals, and in long-term care facilities. We do expect there'll be an uptick in some of the surveillance testing as schools reopen, because, as you know, we've offered that capacity across the school systems. We have colleges returning, but they are returning almost exclusively to with policies that are mandating vaccination amongst their student bodies. So right now we're doing fine with that. With regard to turnaround time, I've heard some reports of people who have had to wait as long as 72 hours, which I thought was a little unusual. I don't know how prevalent that is, because we've been really having rapid turnaround times as there wasn't that much demand for testing previously. But even now, the demand is nowhere near what it used to be. So my hope is that most people can still have a 48-hour window of time and get the result within that. I'll make a point of looking into that further.
Thank you, Dr. Levine.
I may be able to help with that a bit. We do keep track of that on a weekly basis, and we have enough supply at the present rate. I believe we have enough of a supply for the next year. Even when we had increased demand for testing, I believe we have about a 3-month supply at the highest point. Let me just confirm. How many is that? Yeah. Well, yes, we have more than a year's supply at the present rate.
All right. Lisa Loomis, the Valley Reporter.
Good afternoon. I believe my question is for Dr. Levine.
What can you provide us with in terms of demographics about the people who are hospitalized and who are in intensive care? Do you have an age range or an average age for both of those groups?
So I can tell you that they're adults. I can't tell you too much more at this point, but that's the kind of information that we are working on in terms of all of the data sets we have to draw from to be able to portray to you. But I can't give you that today.
Okay, I will look forward to it next week. That's it for me. Thank you very much.
Chris Roy, Newport Daily Express. Chris Roy. All right, we'll move to Andrew McGregor, Caledonian Record.
Yes, good afternoon. Can you hear me?
We can.
Excellent. A question for Commissioner Pisiak. You indicated the pace of new vaccinations was increasing in the last few weeks. Are you seeing that in all regions of the state, and in particular in the Northeast Kingdom?
Yeah, so it's a good question. We looked at it across age groups, so we didn't look at it geographically yesterday. I will say, at glance, it does appear that the vaccinations are going up relative to the amount of people that are already vaccinated geographically. We haven't done an analysis on that. On the age, we did find that the vaccination rates are going up more quickly in the younger population, so the population that are less vaccinated, particularly 12 to 15-year-olds, and then, those 17, 18, and then those in their 20s. We can look at that, though, Andrew, and get back to you for next week, certainly.
Okay, thank you. While you're at the podium, in your presentation, you said we may have several more weeks of daily case growth. And looking at the forecast, does this all suggest that the state could be seeing perhaps 200 or more new cases per day just as kids are heading back to school?
Yeah, so the timing is, I think the timing and then the quantity of cases are two different things. In terms of the timing, it does unfortunately seem like the timing will be at the end of August or the early part of September when cases would be at their highest, whether that's nationally, regionally, or in Vermont. In terms of the quantity, how high that could go, right now we're projecting out 3 weeks, and that would be right around the point when you would hope to start to see cases really slow and start to come down. And we're looking at 7-day average that's around 140 to 147 cases a day. So right now we're about 82 cases a day. So that just gives you some perspective where we are. But we do anticipate them growing again over the next 3 weeks and then starting to come down.
Okay, thank you. Staying on topic, but as a follow-up, and not sure whether this would be for Dr. Levine or perhaps Secretary Smith or French, given what Commissioner Pisiak just said about potentially peaking just as the return to school, how aggressive will the surveillance testing that you intend to deploy in schools be to start the year? And have you given any thought to looking for ways to do surveillance testing among students before they even return to campus?
We'll let Secretary French try and answer that first.
Yeah, good afternoon. Well, I think our major approach is to make it as widely available as possible. It will be voluntary, but we think it is important to make it widely available and also make it available for those that are already vaccinated.
Thanks. I know when you first started the teacher surveillance, the initial week, you tried to do as much of the state as you possibly could and then established a rolling pattern. Is there an intent or a plan to have that initial push with a greater amount and a wider range of surveillance testing at the beginning of the year?
Not yet, but we are, again, working really hard to make the testing widely available, and we're seeing a strong response from districts in terms of signing up for that. So we'll make adjustments as necessary, but we do see the surveillance testing as an important component of our overall mitigation strategy for schools.
And is that going to be available? Well, how quickly into the semester will that be available? Is that starting week 1, week 2? How quickly do you intend to get that started?
So we're working on it now, so perhaps Secretary Smith could give more on the detail, but we fully expect to have it deployed at the start of school.
Could you repeat the question, Andrew?
Just curious how early in the school year the surveillance testing will begin. Is that something you're hoping to get started as soon as kids get back to campus, or will there be a delay?
I think what we're striving for is to make sure that we do it upon their return to campus.
Okay, that's it for me. Thank you, everyone.
All right. Thank you very much for tuning in. We'll see you again next Tuesday.